Hello everyone, welcome back to Wellness Hub 360. Today we're discussing another critical topic in the world of health. We will be discussing about diabetes. Millions of people are affected by diabetes and most people think that it is just the sugar level in their blood. This assumption is partially correct. The purpose of this video is to educate how diabetes impact overall health and well-being. Knowing the ins and outs of diabetes isn't just about getting smart. It's about giving individuals the power to make smart decisions about their health. Because diabetes isn't a one-size-fits-all deal, it's a constant juggling act of medications, monitoring, lifestyle tweaks, and all sorts of daily stuff. And that's where education swoops in to save the day. Let's jump right in. So, diabetes? You've probably heard about it being all about high blood sugar, right? But guess what? It's not just about that sugar roller coaster. Diabetes has its fingers in many pies, messing with different systems in your body. Well, it's here to spill the beans on the not-so-cool impacts of diabetes. And hey, we're not just talking random opinions, we've got the latest research and studies backing us up. Ready to dive into the wide-ranging world of diabetes? Let's do it! Okay, so let's talk about diabetes and your heart. It's kind of a big deal. There's this in-depth study hot off the press in the Journal of the American College of Cardiology that really dives into the whole diabetes-heart health connection. Basically, it's shouting from the rooftops that if you've got diabetes, your ticker needs some extra love. See those high blood sugar levels? They're like troublemakers, messing with your arteries and cranking up the risk of heart issues, attacks, and strokes. So yeah, heart health is a serious concern for folks with diabetes. Gotta keep that ticker in check. All right, let's break it down. So, diabetes isn't exactly a friend to your arteries. It speeds up this thing called atherosclerosis, where plaque decides to set up shop inside your arteries. Not a great party because it makes your arteries narrow and sets the stage for heart attacks, strokes, and peripheral artery disease. Now here's the science bit. Insulin resistance and those long stretches of high blood sugar in diabetes, they're troublemaker for forming more of that plaque and stirring up trouble in your blood vessels. Plus, diabetics often roll with high LDL cholesterol, low HDL cholesterol, and too many triglycerides, basically fast-tracking the plaque party in your arteries. Okay, let's get real about diabetes and your heart. So this thing called coronary artery disease? Well, it likes to show up way earlier and hit harder in folks with diabetes than in the rest of the gang. And when it buddies up with diabetes, it often brings along some extra trouble, like messing with multiple vessels because of this widespread plaque party. Now, why does this matter? Because it cranks up the risk and seriousness of heart attacks. But wait, there's more. Diabetics also play this kind of risky game where they might not feel the warning signs. It's called silent ischemia, where the heart isn't getting enough blood, but there aren't the usual red flags. And then there's this whole thing about sudden deaths from heart issues in diabetics. Why? Blame it on autonomic neuropathy. It messes with how they perceive pain, so the usual signals that something's wrong don't always show up. So yeah, it's a bit of a double whammy for diabetics when it comes to their hearts. Alright, let's talk about diabetes and your heart muscles. So diabetes kind of hits the fast forward button on something called cardiomyopathy. It's like a sneak attack on your heart muscle. What happens? Well, the heart muscle ends up in this not-so-great state. It gets bigger, thicker, or stiff, and that messes with its pumping job. Pumping blood effectively becomes a bit of a challenge. Now here's the kicker. If you've got diabetes, you're in the ring for a higher chance, like 2 to 5 times more likely, to tag along with heart failure compared to the regular crew. It's like diabetes is adding some extra challenges to the heart's to-do list. All of this adds up to a big neon sign saying, hey, take care of your heart if you've got diabetes. The evidence is piling up, shouting about the need for top-notch cardiovascular care when you're managing diabetes. It's all connected, and keeping a close eye on your heart is key. Next, look at the kidney connection. There's this important connection between diabetes and kidney issues, and guess where I found this info? The American Journal of Kidney Diseases, that's where. They did some research that really throw a light on how serious this link is. Okay, so there's this condition called diabetic nephropathy, and it's not something to mess around with. It messes with your kidneys, and the crazy part is that it sneaks up on you over time. It's a big deal because it puts you at a pretty high risk. Now, the study hammers home the idea that keeping a close eye on things and jumping in early is key. Like, you really gotta stay on top of it to avoid those kidney complications if you're dealing with diabetes. Alright, let's dive a bit deeper into this whole diabetic nephropathy deal. So imagine this. Your kidneys take a hit because of diabetes. It's a big deal worldwide, playing a leading role in causing chronic kidney disease and end-stage renal disease. Whether you're rocking type 1 or type 2 diabetes, both can throw you into the nephropathy mix. And get this stat, up to 40% of people with diabetes end up with some level of kidney damage. Mind-blowing, huh? So seriously, don't sleep on keeping tabs on your kidney health, especially if you're part of the diabetes club. Now let's talk about the science behind it. The pathophysiology of diabetic nephropathy is like a domino effect of uncontrolled blood sugar levels and hypertension messing with the small blood vessels in your kidneys. This wreaks havoc on their ability to filter out waste. Too much sugar in the blood? It messes with the proteins and structures in your kidneys, throwing their normal function out of whack. Plus, there are these hemodynamic changes messing with blood flow in the kidneys, making the whole situation worse. And guess what? Diabetic nephropathy has its own evolution stages. It starts with microalbuminuria, showing small bits of protein in your urine. Then, you move on to overt nephropathy or clinical albuminuria, where there's a significant protein party happening in your urine. And the grand finale? End-stage renal disease. That's when your kidneys throw in the towel, and you might need dialysis or a kidney transplant to keep things rolling. So it's not just a small issue, it's a journey and it's no joke. Keep those kidneys in check. Okay, let's talk about more than just what's happening with your kidneys in this diabetic nephropathy saga. It turns out this thing is like a puppet master pulling strings on your blood pressure too. As kidney disease kicks it up a notch, you start holding on to more fluids, which spells trouble with high blood pressure that's tough to wrangle in. And it doesn't stop there. You might notice your legs swelling up and feeling a bit out of breath. But wait, there's more. Kidney issues don't just mess with your blood pressure and make you puff up. They also lead to a buildup of waste and throw off the balance of electrolytes in your blood. Now that might sound like a bunch of science mumbo-jumbo, but here's the deal. It cranks up the risk of cardiovascular disease, kidney infections, and a bunch of other complications because your kidneys aren't doing their A-game. This whole situation is like a tangled web, showing how diabetes and kidney health are like partners in crime. It's not just about fixing things when they break. It's about being proactive and taking steps to prevent the chaos in the first place. So yeah, managing this duo is a big deal, and understanding the whole picture is key to keeping things on the right track. Stay ahead of the game, folks! As this video is getting longer, we will take a break here and continue in the next video to talk about how diabetes affects eyes, damages nerves, skin care, and mental health. The link to the second part of the video is provided in the description below. If you're new here, don't forget to subscribe and hit the notification bell for more health-related content. Thank you for joining us today on Wellness Hub 360. And as always, stay healthy.